this evening. It's a pleasure to be here with you guys again. I appreciate the opportunity to do that. Just to also reiterate what Cindy said, it's been a pleasure working with this team. We've had a lot of fun, a lot of good conversations back and forth. We really appreciate the time and energy that they put into this as well. Because, this engagement is not just about us, it's that interaction with the data that we can get and understanding what we're getting and seeing and making sure that that makes a lot of sense. As Cindy mentioned, typically like to kind of highlight the organization in a stoplight format. I hope, as a board member, in the last 4.5 months, in the seat that you sit, you've come to realize and appreciate that running a hospital is a very complicated endeavor. There are a lot of hats that you have to wear as a member of the team, and a lot of different focus areas that you have to address in any given moment of the day. And that just adds to the fun of it, but it also adds to the complicated aspect of trying to provide good quality patient care, and that's what this organization is clearly very much about. So we want to kind of focus in on those key elements of what we reviewed. Keep in mind that we did not come on site yet to go in depth into some of these areas outside of dialoguing with the team and clarifying some of the data. We did not review quality aspects or patient care directly. We were here to observe those components of it. Really to take a look at it from a financial operational component. How's the organization doing? And where are there some opportunities for us to kind of focus in on? So the first thing you see here, which is very good, is there's only one area of red. And that's a good place to be. Oftentimes we go into organizations where there's a lot of red, a lot of areas of significant need and focus, a lot of areas of concern that pop up really quickly. The fact that Somervell does not have that is a very good thing. That speaks highly to the team and the medical staff here and the focus that they've had over the years. We'll talk about the managed care and why that's one as well. Another thing you see is not everything is green, which is also a good thing as well. Very rarely do you walk into an organization that everything is lined up with green. It just doesn't happen. It's too complicated of a business. There are too many variables that come to play at you, and it's impossible to run an organization all in the green. In fact, hospitals all across the country, it's a very big name hospital. Intermountain Healthcare, Memorial Hermann. Some that you're familiar with, Scott and White, Baylor, they don't run in the green, 100%. That just isn't possible. So the yellow flag is typically where we want to see organizations sit with some of those areas in the green, and that's very much what Somervell's profiles is. That's a very good thing. So just from a quick high-level aspect, what does that tell us? Well, Somervell's is on a good foundation. That's very important. So that speaks highly to everybody involved from the community standpoint all the way through the management team and you guys as board members, even though you're new as board members, asking the right questions. So we kind of walk through these, and as I talk about them, if you have questions, please, we want to make this interactive and kind of dialogue, but not just with us, but also with the management team that's here too. The first thing we take a look at is just really high level. What's going on with the organization? What's happening from a general financial performance standpoint? What are some of the trends that we're seeing? And what are some of the things that are impacting those trends, et cetera? So Somervell is in a sort of a yellow format or forecast for where they sit right now. And that's principally related to the fact that we're a standalone facility. Volume is very important for the financial well-being of the institution. And overall, from an operations perspective, because we are a smaller facility, the impact of that volume is huge in the organization. And just a small influx of patients, be it outpatient, be it through the ER, be it inpatient, has a tremendous financial impact at the bottom line of the institution. So what we've seen from a trend standpoint is a little bit of a softening of volume, which right now in healthcare is a very common thing, no matter what market you're in. DFW, notwithstanding, the same issues going on there. THR, Baylor, some of the other institutions, volume is an issue. And that's reflective of the economics that we're generally facing in the country. But that as a concern, volume is something that needs to be focused in on. So we look at strategy, how do we grow volume? Where is volume coming from? Cindy mentioned we took a look at the overall market aspect of where patients are coming from, the demographic fold as well. And that's very important as we start to understand strategy as it relates to vision. How does that relate to our financial performance? What do we need to do to generate the right volume through our doors? So that's why we start there. Get an idea of what's going on with volume, what's happening, and how does that impact us.
Mike, let me just add, one of the things that we've really seen in terms of volume is we looked at it, and I think that we did financials through the end of February, I think, right? But it was really outpatient surgery that had fallen off the most. I will tell you that we just sent out sort of a news brief to some of our hospitals that is saying it's that drop in outpatient surgeries because of the consumers who are saying, ooh, if it's elective, I'm going to put it off. I'm still a little bit concerned about my coverage or perhaps my ability to pay the deductibles. And so that's the one thing that gets kind of put on the back burner. And so, as Mike said, from a strategy standpoint, the group really needs to begin to think in terms of how do we overcome that? How do we build more volume, particularly on an outpatient basis? Okay.
So once we understand sort of the global picture of what's happening in the market, what's going on from a volume standpoint, we start to dive down into a lot of the data that we keep providing. We begin to look at that across multiple aspects. One area of clear focus is the revenue cycle. What happens with the paper aspect when the patient gets scheduled with individually? How does that paper move along with that patient? And ultimately, how does that bill get dropped? And then ultimately, how does that those fees get collected in front of them? Really great to see that Glenrose is in the green on a lot of metrics. It says that the revenue cycle component is doing very, very well from that standpoint. So that's kudos to the team and the focus they have in processing the paper side of healthcare, which is a very sort of complicated aspect of getting the information that we need to get in order to drop a bill and collect on that bill. And that's always a challenge. And a lot of hospitals don't do that very well. The fact that we're in the green is very good. And the way we measure that in the revenue cycle component, there's probably somewhere around 150 different measurement metrics that you can look at. And it's anywhere from how well we're scheduling to how timely the bill gets collected on within short windows of time, 15 days, 30 days, 45 days, 60 days, etc. And all the aspects that are in between that. So we looked at all those various components and Glenrose falls into the green very well in that. There are a few areas where there's potential opportunity that we've talked to Ray and Glenn about, Gary about, excuse me, and I think they're on top of those opportunities. We can dialogue more about that from that standpoint as well. Likewise, when we look at the revenue cycle, we look at how patients are classified from a financial standpoint. Lots of Medicare-dependent type of patients that come into this facility. There is a capture of managed care. So what we want to understand there is how well are our contracts? How well they do from a payment perspective, as well as to the volume that we're seeing in those respective managed care contracts, and what's the cost of business within those managed care contracts. And it's not untypical, particularly across Texas, and really even outside of the major metroplexes across the state, to see managed care be an issue for the hospital. We have several hospitals that are part of the CNC system that when they first became part of us, this was where they sat in that red zone aspect of it, because they're standalone. It's hard to leverage managed care. It's hard to develop a story around managed care with your employers in the market. So that always typically pops up immediately as an opportunity to focus. And Glenrose has that opportunity. And that's a very known issue with the team. We talked about that a lot. The fact that Glenrose is standalone, it's difficult to leverage sometimes the Uniteds of the world, the Cignas of the world, the Aetnas of the world, even the Blue Crosses of the world to really tell our story and to really get the rates we need to do that are going to have an impact for us. So you'll see some recommendations that are key recommendations about developing some key strategies around managed care. And those strategies are really kind of multi-layered. It's not just about the hospital when you talk about managed care, it's also about the community as a whole. What's right within the community, what's right with the employers. Clearly understand that there's a cost to healthcare. That's not just the cost of the hospital, but it's the cost as an employer. What's happening in the school district? What's happening with our major employers in town? What's the cost of providing insurance to their employees? And likewise, the choices that they're making, how does that impact us in the healthcare sector? How does that impact the physicians that are also having to do with this as well?